I was always so jealous as a child of kids that didn't have this condition. So really, I probably tell people to really appreciate your health.
One of our mantras is when you're not able to breathe, it doesn't matter what else you can do or not. It affects your whole life.
And we're here today for our annual Bike for Breath ride to raise money to support our programs and services that we provide here in the local community. We're here because breathing should not be a struggle or risk. We support medical research to help find cures for lung disease or better treatments. We also provide information to patients to help them cope with living with lung disease. We work at a grassroots level so that we understand patient needs, community needs with our services, but we also then take that to a public health policy level and air quality advocacy.
We are here representing the Team Second Wind, which is a team that I've had for about 7 years, riding this great ride. I organized this team hoping to bring awareness for cystic fibrosis and lung transplantation, of how life is so different now with a new set of lungs and how easy things are. And we all have a gratitude and an awakening feeling. It's really like a second chance. So that's why we call ourselves Team Second Wind.
Actually, I first met Anna and Isa when they came to a step aerobics class that I attend, and I thought, who is this woman who comes to the step aerobics class with a nasal cannula attached to an oxygen tank? And I thought, how courageous is that? The fact that I'm blessed with the health that I have and the lungs that I have, I can do something with the body that I have.
I'm really happy to be here, but at the same time, as a representative of Team Second Wind, there's always a little bit of bittersweet feelings because there are some people who used to ride and are no longer with us. For example, we have a key member who had come to this ride for the last 6 years, and unfortunately she received a lung transplant in, I think, 2002, but she's in the intensive care unit right now, very sick. That is the life of a lung transplant recipient. We have to treasure every day of health. On the other hand, I have a new friend coming today who just received a lung transplant 2 months ago.
The disease I have, pulmonary hypertension, affects both the heart and the lung. When I tell people that I have a heart disease, a disease that affects the heart, people start panicking, and they somehow think that it's more severe than when I mention that I have a lung disease. Lung transplant is, of course, a life-extending surgery, but it's also about being more active and more independent in your being able to do a lot of things in your life.
My quality of life prior to the surgery was horrendous. 6 hours of medical treatments every single day. I wasn't working, wasn't going to school, and since I've had my transplant, my life has just done a 180. I'm in school getting my master's degree, looking for a job, exercising, doing 18-mile bike rides. I'm not as interested in the quantity of my life as I am in the quality, and my quality of life is just so much incredibly better now.